My name's Hannah Hunter. I'm a specialist adult allergy dietitian at Guy's Hospital. Eosinophilic esophagitis, or EOE as it's easier to say, is an inflammatory condition of the esophagus. And although it's not a very well-known condition, it is actually not a rare disease, so it has a prevalence similar to that of Crohn's disease. It affects 3 times more men than women and affects children in a similar way to adults. Symptoms that we see in adults are typically food impaction, so food getting stuck in the esophagus, or difficulty swallowing food, sometimes needing endoscopic removal. In children, we often see symptoms such as poor feeding difficulties or difficulty gaining weight. And what we often see as well, coexisting with EOE, is other allergic conditions such as asthma, hay fever, food allergy, or eczema. And it can only be diagnosed during endoscopy. So a camera needs to be put down the throat and take esophageal biopsies, typically at least 6 from different levels. And these biopsies will be looked at under the microscope and checked for a white blood cell called eosinophils. And if the eosinophil count is high, that can be indicative of eosinophilic esophagitis. There are 3 main treatments of EOE. The 3 Ds: there's drugs, diet, and dilatation. So drugs that are typically used are proton pump inhibitors such as lansoprazole or omeprazole, which can be very effective even in the absence of reflux. We can use dietary intervention, so food elimination diets. So often there are food triggers driving EOE, and these are typically the most common will be milk in both adults and children. Lastly, for patients with narrowing or strictures in the esophagus, we use dilatation, so stretching, which can greatly improve symptoms for patients.